guys, welcome back to my channel. I wanted to talk to you guys about an exam that I had today. I have been freaking out about this test for, I say 2 weeks, but ever since I seen the grade for my last test. I don't know if you guys remember, but I was really struggling on this in this class, really in both classes, but this is the one in particular that was coming up next, and I had that exam today. I made a 78. So I passed the test. I'm really happy with that grade. I know a 78 doesn't seem like a very high grade to some, but for me it's really good because you have to have a 74.45% at the end of the semester. And my last test grade I made a 58, which was pretty devastating. I mean, it's mental health. I feel like it's one of those things, either you understand it or you don't understand it. And a part of that is because there's a lot of therapeutic communication, and that was something that I wasn't quite grasping, because I feel like in LPN school we just kind of touched base with it. We barely skimmed over it. We didn't go into detail on every disorder that you deal with. You know, you have schizophrenia, you have schizoid, schizotypal, paranoid schizophrenia, and then you have your personality disorders. You've got histrionic, you've got narcissistic, you've got bipolar. My cat's trying to knock my little stand over. Want to see him? Miguel calls him our little Black Panther. Well, his little Black Panther, because he doesn't like me. I don't know why. You know what? I saved his life, and he's just, I don't know why he doesn't like me. Say hi. Even though you hate me. He's weirded out. Okay. What was I talking about? Like I said, you've got a ton of personality disorders. I can't think of all of them on the top of my head. Borderline, which I think every woman thinks that they're borderline because they have their days where they love you and then 5 minutes later they hate you. So I understood that personality disorder very well. I knew exactly how to deal with those. So personality disorders, psychotic disorders. Anyways, it was over 3 chapters. And the thing that I really focused on this time, because when you fail something, I feel like that's where you learn the most about yourself. Because at that point, you're going to have to reevaluate your studying, how you're understanding all this information. You have to take a step back when you fail a test. You have to think of another way. How am I going to pass this next one? What can I do to get a better grade the next time? That's what I really had to do, guys. Like, I was sitting at borderline passing, but barely, and I knew that I had to get it into gear, figure this out, and really knock this one out of the park. And 78 is knocking it out of the park for me, guys. I mean, I try to shoot big, and a lot of people, professors and instructors say, you know, you may be a straight A student, but when you get into nursing school, get used to the B's and C's, because you're gonna drop down, and that's okay. It's not the end of the world if you don't get the highest grade on the test, or, you know, if you don't get a B on the test, because in the end, even if you get a C and then the person next to you gets an A, at the end of the day, you're all gonna be nurses. Doesn't matter. So Team C over here, shooting for a C. But today, I felt like I went into it just knowing what the questions were asking. I really focused on, how do you talk to these people with the personality disorders? because sometimes what you say to one person with this personality disorder is going to be completely opposite for what you say to this person. So you have to pay attention to what type of personality disorder they have and then go from there. 2 things I know that you do not do on a mental health exam. You never ask them why, and you never tell them how they're feeling. Like say a patient looks like they're depressed. You're never going to go to that patient and say, you look like you're depressed. You want them to be able to express feelings on their own. And a person that is thinking of committing suicide, or you think they look very severely depressed, you need to be straightforward and ask them, hey, are you thinking about ending your life? And do you have a plan? That's a lot of people may be hesitant on going for that answer because it's so straightforward. Like, how are you going to come out and ask somebody if they want to kill themselves? But it's important because you need to know right away if they are feeling that way, because so you can get them on those suicide precautions, getting someone monitoring them 1-to-1. It's so important. I really wanted to make this video just to let you guys know that even if you do fail an exam, it's not the end of the world. You may feel that way when you see that grade, but you've just got to step it up in the next exam. You got to set back, rethink, what are you doing? Could I have done better? Let's be honest. A lot of us procrastinate. I know I'm bad at procrastinating because sometimes I just get tired. You know, sometimes I just want to lay on the couch. And because when you're working full-time, going to school full-time, trying to work out, trying to eat healthy, it can get you pretty exhausted. In the end, you're going to feel better physically if you do stay healthy, but it's not an easy thing to do by no means. A tip also is make sure you read your chapters. I mean, I started studying for this next exam right after my CM1 test and immediately started reading the chapters. I made my own study guide. I talked about every single disorder, wrote out the symptoms and how you would speak to these people, and then what type of medications. Medications is important too, guys. Like, I know there's so many medications, but one thing that has helped me is getting online, because we have a HESI book that we can open and we can use it online as well. And there's these questions that you can do for each section that you're in, and this one was for psychiatric. And I didn't do that for the last exam, and for this one, I feel like it really, really helped me out. I mean, of course, none of the questions were on the test, but I feel like a lot of them were formatted in the same way, just different words in it. It was just reworded. So go take those exams on the HESI, questions, whatever, and just keep doing it. Keep doing questions. Get your test strategy down. I mean, I look up on YouTube test strategies. I look up, there's one lady I looked up on YouTube that I'll have to link her below, but she really helped me in explaining each personality disorder, how to speak to them, and what to do for them. And it really opened my eyes. Sometimes listening to your instructors just isn't enough. I mean, they're great instructors, but for some reason, sometimes when you hear it from somebody else, it just makes more sense. I don't know if that's because you're hearing it from more than one, it's like repetitiveness, but that's what's really helped me is YouTube for one, reading my chapters, doing test questions through HESI or through your book. I'm gonna go grab my book real fast to show you guys the book that we have assigned to us for mental health, and I feel like it really helped me. Here is the book that I used. It's Townsend Morgan, Essentials of Psychiatric Mental Health Nursing. And you see this little thing right here? When you open the book up, it has an access code inside, and it shows you where to go, davisedge.com. You log in, join, and you put this access code in. And in there, there's parts where you can go in and do practice questions, and it's going to be over each chapter. So I selected, and you can do it in 5 little tests, questions, 10 or 15. And I felt like it helped me better if I did it in 5. I tried it with 10 and then I couldn't really retain the information. So I would do 5 questions, try to answer them on my own, and then it gives you the rationale as to why this answer was right and why these answers were wrong. And when it gives you the rationale, don't just read why it's right. There's been so many reasons why it's wrong that has helped me, because it'll tell you, like, say for instance, drugs, medications used for this disorder, like in the question it's used for this disorder. So the other ones listed will tell you which disorders those medications are used for. So always read all the rationales, the right and the wrong ones, because it gives you a lot of information. Also, when you're going in for those practice quizzes, you can select each chapter. You can select up to as many as you want to, all of them if you want, but I specifically just would click the ones that my exam is over, and it would just quiz you over what's in the book, and I feel like it really helped me. The moral of the story is, do not give up even if you fail an exam. Or heck, even if you fail a semester, it doesn't matter. A lot of people don't know this, but I did not pass my NCLEX the first time. I was so devastated. I mean, here I am taking a whole year of my life, pretty much not making any income month to month. The program I went to was from January to December. We had 1 week off for spring break, 2 weeks off for summer break, and then a week off for Thanksgiving, the whole entire year. And you could only miss 10 days. So the super devastating part for me was, did I really just spend a whole year of my life to fail the NCLEX and not even be able to work as a nurse? Like, what did I just do? And that really set me back and really had me depressed for a little bit. But what I realized is, this is like, I can go back, I can do it again. What can I do differently? You've always got to ask yourself, what can I do differently? That's where you learn the most, is when you fail at something. You don't have to give up. No matter what, just keep going, kill it the next time, study your butt off, and kill the next exam. That's all you can do. And you can do it. Alright guys, that's all that I have for you. I know it was a big jumble, but I just wanted to update you on my exam, maybe a couple tips in there to help you for your next exam. And don't forget to like and subscribe, and we'll see you guys in the next one. Bye.